Hello, everyone. Thank you for coming to this the meeting for the rheumatologist. I guess we'll start since we have a shorter period of time today. Today we have Dr. Maggie Cadet, rheumatologist. I'll give you
Hmm?
the floor.
Doctor, you're on mute.
You're mute.
Oh, okay.
Yeah.
Can you hear me?
Yes.
Yeah.
Hi, everyone. Thanks for having me. I'm Dr. Maggie Cadet. I am a rheumatologist in New York City. Some of you may not know what a rheumatologist is, so I'll start off with that. A rheumatologist is a specialist after doing internal medicine residency. There is a rheumatology fellowship for 2 years, but a rheumatologist is a physician that takes care of any disorder focusing on muscle, bones, joints, tendons, and ligaments. So this can include any types of arthritis. I'm sure many of you have heard of rheumatoid arthritis, psoriatic arthritis. If you're a golfer, Phil Mickelson has it. Autoimmune diseases. So autoimmune diseases like lupus or Sjogren's syndrome, which basically means that your body's own immune system turns on itself after being activated and attacks its own organs. So with rheumatology diseases or autoimmune diseases, you can have disorders of the kidneys, the lungs, basically any organ, the nervous system, hematologic system, and then that can lead to complications. But I also deal with just simple joint disorders like tendon, ligament strains from sports injuries. I deal with bone disorders like osteoporosis, low bone mass, and bone mineral density. And basically any other types of inflammation of the blood vessel as well. If I'm going to tell you a little bit about myself, and then we'll, turn it to the floor and you can ask me questions. So I did my undergraduate at Georgetown University. I took a year off to work at Boston. I worked at one of the Harvard Medical Centers there and did some public health courses because I wasn't sure at the time if I wanted to go straight into medical school or do public health research. After that, I decided I wanted to pursue a job in clinical medicine initially, and I'll talk to you about other specialties or other focus areas later, and then attended Drexel University in Pennsylvania. And I chose that medical school because at the time it had clinical clerkships early on. In, I think, second year, we were exposed early on clinically, and it had a great student body full of diversity. So for me, that was really important. And it was one of the medical schools that accepted women early. So it was a big female population as well, which I liked. I then decided to go on to do internal medicine internship and completed my residency at Yale New Haven Hospital, and then decided to focus on rheumatology fellowship for 2 years and did it at NYU Hospital for Joint Diseases. A side note for me, I actually matched in anesthesiology initially because I loved women's health and I wanted to do OB anesthesia, but it wasn't until my internship year that I realized that I loved learning more about autoimmune diseases, connecting with women, especially who are affected by autoimmune diseases primarily, and African-American females as well, and decided to pursue a internal medicine residency and then decided to do a fellowship as well. So that's basically the short synopsis of my journey, but I know you all may have questions about medical school, the path to get into medical school and residency, so I'm more than happy to answer any questions.
Thank you, doctor, for that wonderful introduction. It was really interesting. It was really, insightful. Guys, so now please drop your questions in the chat. Bear in mind, we really have too much time today because, obviously, it was a short meeting. So
I'm sorry.
No, it's okay. It's okay.
Okay, I'll do a longer one later.
Do you have access to the chat?
I do see chat. So what did you major in? So I actually majored in biology and I was pre-med at Georgetown. I will say this, that I almost wish, now I have hindsight, I loved literature and English and I took many English classes and literature classes. I would say as a medical student to, broaden your horizons, there's plenty of time for pre-medical and science courses. So it's very important that you really do have a broad base, and English, literature, engineering, business, arts, they will come into play in your career. So if you do have a passion for those, do not feel that you need to major in a science to get into medical school or, residency or other, future graduate pathways. So but I did take a lot of literature classes. I took Afro-Caribbean, Shakespeare. I did a lot of writing in medical school. I took a lot of language classes, Spanish, Catalan, and other classes. So again, diversify your palette. I saw someone say, what is your typical day like? So I am a mother, so I have other responsibilities other than work. I'm usually up, honestly, by 4:35, which is a great practice because you will, when you're in residency and internship, you are going to be up rounding really early. So I start my day, I usually try to work out. It's very helpful to stay sane and stay active while you're pursuing a degree in medicine because it's very challenging and very stressful at times, and you have to really have other extracurricular activities in your life. I'm in the office really by 8:30 or 8 o'clock. So I walk to work in the city, especially during COVID. And so I do have to get up a little bit earlier. I'm in clinical practice right now. I've done academics. So when I did academics, there's a little bit more flexibility because you can teach students, which I did. I did clinics with the fellows and the residents. I worked on lectures, and I did clinics and also inpatient consults. So I did work in a hospital at one point. Right now, I'm seeing patients solely in the office just because of lifestyle changes. And a day can range from about 18 to 20 patients. So it is a full day. A lot of, I would say half of my day is patient consults, like new patient consults, and then there's follow-ups. And that usually takes me to about 5 o'clock, 5:30. And then I, go home. I have a child, so I'm doing homework and playing and cooking and cleaning, and it's a really long day. I will say when I was doing academics, again, I probably like that a little bit more just because there is variety, and it's good I love teaching, I love speaking, I love educating. So I will probably go back into that, but it was great for me to see both aspects. Okay, so I saw another question. What was the hardest class I took in, I want to verify, is that for medical school or just in college or whenever? For medical school. Medical school, I will say gross anatomy. That was one of my hardest. It was one of the first things you had to take. And it is a class that's very detailed. You have to study so many structures, nerves, tendons. If you get, lightheaded from formaldehyde, that might be tough. So that was really a class I had to take a lot of time and pay attention to. Also anatomy, not microanatomy and histology, looking at path slides, those were the hardest. But that's in the first year. I think if you can get through the first year classes, then the other years there's more clinical relevance to the classes and things make sense. But you do need the basic. And honestly, you do need, whether you're going to be a surgeon or any other specialty, you do need to have a foundation of the body. Another person asked me, is it recommended to take a gap year? I will actually say I would do it because, again, medicine's lifelong. You have your whole life to do it. And if there's something else you want to do, especially now, I think it's good to diversify your palette and, be really just try different things, because once you get into medicine, the routine, it is very difficult to set time for that. So if you want to take a year and do like even business, do an internship. I love media, so I'm on Instagram. I have my own website. I wish I had taken a year and done an internship at a media company and just gotten the foundation at that point. But I think now it's more talked about. Physicians are talking more about just having other outlets. When I was, growing up and doing this, it was not talked about a lot. So I would say do a gap year. If you don't want to do it, you don't have to. But if you feel pressure to do something different before you go into like the long haul, then I would do it. How do I balance a busy schedule? I'm not going to lie to you. Internship is really tough after medical school. That was probably the toughest year because you really are starting at the bottom of the totem pole and you have so many responsibilities and your learning curve is so great. It doesn't get easier as a fellow or an attending because now you're really responsible. You are solely responsible. I think what you have to do is, again, try to make time for your family. You're not going to make time for everyone because there's just not enough time. But pick your 2 or 3 closest family and friends and make the time and, stay connected. Ask for help from people if you are feeling pressure or anxiety, because now we do know that it is depression and mental health and physician is something that we're focusing on more. And you have to be healthy for yourself in order to be healthy for patients. Find an activity that you like. So for me, I was a figure skater growing up, and I competed it. And as I've grown up, I've also taken on tennis and running. So those are my outlets in terms of just being able to detach from medicine for a little bit. And, just getting some exercise in just to build your physical and mental strength. And, journal and read. Okay, so another question, does rheumatology have a good work-life balance, and why did I become a rheumatologist? Well, I said I figure skated when I was younger, and I was into ballet and dance. So I knew I liked something sports-related, muscle-related, or joint-related. I did not want to do surgery, so I did not want to become an orthopedic surgeon. I will say I probably could have gone into sports medicine, which is another specialty that you can do after you do family medicine or surgery or internal medicine. And that's something I may have looked into more. The specific reason why I got into rheumatology is because in medical school, I met someone who was diagnosed with lupus, and she was African-American, she was in her 20s, and she ended up passing away from complications of lupus, and she wasn't educated about the disease at all. And I don't think she had a good physician who really talked to her about the complications from autoimmune diseases. And so I found during my journey in medical school and internship and residency, more and more women and men, especially minority descent or minority cultures, definitely were affected by these diseases, and I felt I could make a difference. And rheumatology is a specialty also that involves so many other specialties. You're not just focused on one organ, you have to look in the entire body. So it's really intellectual. You have to think about things more. It's very interesting because it combines immunology, pathology, sports medicine, and basically every other specialty. So you do get to consult with other specialties, which I like as well. In terms of work-life balance, I would say it's not bad compared to most other specialties. You're not on call a lot. If you're on call, it's basically like a few times a month. You don't have many emergencies. So if you work with a hospital or affiliated with a hospital, most emergencies like lupus flares, really severe lupus flares, vasculitis, will probably go to the hospital. And again, there's not that many emergencies. You do have long days and the cases are complicated. So I think you're using a lot of intellectual power. But again, compared to most other specialties, it's not that bad. And it's a 2-year fellowship. I think now if you want to do research, it's 3 years. But again, it's not so long. Any other questions? Again,
Yeah,
go
sorry,
ahead.
go ahead. No, sorry, go ahead.
Rheumatology is very interesting, again, because you do have different, again, I could see someone who has a rotator cuff tear. I'm not doing surgery on that person. I will refer to orthopedics, but they usually get to me first. Then I'll see someone who might have lupus. I might see someone who has rheumatoid arthritis. I might see someone who has osteoporosis and has low bone density and has fractures. So you do get a wide range of people, and that's one of the reasons why, just to keep it fresh, you're not seeing the same thing over and over again, is one of the reasons why I really like this specialty.
Yeah, I was gonna say that I think there's one question that you skipped here. If you scroll back up, it was from Miguel Rasco. I don't know if you want me to say it or.
Let me see. Can I see it? Oh, I don't know how to see. Can you read it to me, or
Yeah,
do you
it
have
was.
it?
What were some things that you did in high school that helped you get into Georgetown?
Oh, so for me, I was a competitive figure skater. So and a dancer, and I played piano. So that kind of set me apart from other people, because it's a sport or sports or activities that showed that I had commitment and dedication to. And I started doing these things since I was like 3 or 4, except for ice skating, I started at 8. But again, I had to learn time management. I had to stay focused. It was something that I had to really be dedicated to. So that was something I think that set me apart. Also, I reached out to my alumni network and got to know them. So that way, when it was time to do the interviews locally, which might happen with, COVID right now, it was something that, people already knew me. I also did volunteering at a hospital. I did nothing too major, but I looked at a pathologist. So I was able to do slides, which actually ended up being helpful for me for rheumatology, because we do a lot of pathology review when we're doing muscle biopsies and skin biopsies. So again, I think having a well-rounded resume is important. It doesn't, now I think medical schools and colleges are not just looking at academics. Yes, you do have to have strong academics, but it can't just be the only thing that you have. So it's basically, being a well-rounded person, showing focus, showing determination, also, having challenges. As a figure skater, I competed. There were times I did well, there were times I didn't, having to practice every day. So again, showing that, like, even if you don't succeed the first time, that you're willing to stick with it. And that's really necessary for medical school, as well as, the rest of your medical career. Okay, I did see someone, does my job meet the expectations? So I am going to be completely honest. So I know now, after I've been in practice for several years, what I'm good at and what I enjoy. There are realities to medicine. So medicine, we all go into this because we love medicine, and it is an amazing field. You're taking care of people, you're helping people. But medicine is also business now. And you'll find that wherever you go, whether you go in clinical practice, academic practice, you need to make money to survive. And so you may be seeing a lot of patients, and that's why a lot of physicians are getting burnt out. I think the important thing to focus on is trying to find a job that really suits your needs. If you're working, if you're a parent, you might have to do something that's not full time and be able to balance that. If if you are someone that cannot see someone in 15, 20 minutes, you have to be able to understand that and find a job where that's not part of the equation. I've been in academic centers, private practice, insurance-based practices. I know now what each one offers, and going forward, I can make that decision. I like teaching, so I probably will end up at an academic center eventually back again and do teaching, and also be involved with the Office of Diversity and medical student recruitment and resident recruitment. So again, just being able to recognize that it is a business, and you do have to have a business mindset, which is not something they taught us when we were in medical school and college, but it's something you should be aware of. If you want to be part of a practice, learn the business of opening a practice. Learn what insurances are, what are insurances like? What type of insurances do most of these practices take? Learn about Medicare and Medicaid. So these are all, you have to learn more about the healthcare system as well. There was another question, but I didn't get to see it.
Are you talking about the how many years does it take to, like, how many years did you have to study to become a rheumatologist?
Yes. So I did 4 years of medical school. 4 years of college, 4 years of medical school, 3 years residency, 2 years fellowship. So it's like, let's see, 8, 2 years, 10. So it's about whether you go into rheumatology or anything else, it will take about 10 years. If you're in a surgical specialty, it will take much longer, and then most surgical specialties will specialize. So again, you have to be cognizant of that too. I will say, do not jeopardize or cut out your personal experiences as well. If you want to have a child, have a child, for, you know, for women out there. There's no perfect time to have a kid. And honestly, the older you get, it does get harder because you are, unless you have a very flexible job, you are responsible for seeing patients. Whereas in maybe residency or fellowship, probably fellowship might be a good time to do it because there are research blocks and there is some time off, and you're not working as hard as you are as an intern or resident. So that might be a good time. But even for men, you know, you have to, you know, if you want to start a family, if you want to be present more, you have, you know, do not hold those things off just for medicine. Because again, medicine will always be there. There's always time to work at another job, but you know, other things will pass you by.
Yeah.
Someone said, what was your favorite experience, right, thus far?
Yeah, that was one of the questions.
I will say a couple of things. So another thing you might want to do is, if you're, whether you're a rheumatologist or another specialist, join your local chapter. So for me, I have the Arthritis Foundation, as well as the American College of Rheumatology. And these are organizations where you can get involved in and participate in. And it was so cool. A few years ago, I was able to, I love advocacy, and I was part of this advocacy team and traveled down to Washington, D.C. I was able to try to lobby for a co-sponsorship of a bill for the Arthritis Cure Act, and that was going to promote research and advocacy for patients, for medications, as well as therapy and diagnostic testing. So I got to go in the Capitol, I got to meet with the senators, and I thought that was a great experience because I was doing something for the good of the people. I love educating other people because a lot of people don't know about arthritis and how debilitating it can be. And it's up there with hypertension, heart disease, and diabetes as one of the leading causes of disability. So I felt like I was doing my part, I was giving back, and it was just cool to be in a capital. And since I was at Georgetown, it was great to go back to Washington, D.C. and do some advocacy work. So that's probably something I probably will end up doing as well later in my career. Just don't be limited. You don't have to just see patients if you're a doctor or if you have an MD degree. You could go into pharmaceuticals. You can be part of a nonprofit organization. You can, again, teach. You could be part of academics. There are consulting groups, you know, that combine business as well as medicine. So there's a wide range of things to do. I just remember in medical school, we didn't talk about that. But now that physicians are talking more about it, it's something you can do. I blog. I love writing. So I blog about my specialty. I blog about my patient experiences, obviously being HIPAA compliant. But I love sharing my knowledge with other people, and I'm starting my website. And I can give you I'm on Instagram. So it's Dr. Maggie Cadet. And yeah, I'm sorry, Dr. Maggie Cadet. And my website is www.maggiecadetmd.com. So you could see what I do and how I educate people through those means. I think someone said, what was the hardest thing? There are a lot of hard things about the journey. So I think in your first year of medical school, first 2 years are pretty tough because you're studying a lot. It's nonstop. I mean, just trying to stay awake sometimes is difficult, and you're just absorbing all this information. Plus, you have to take step 1, step 2, which are examinations you have to do. So that was really tough. And I think just getting through internship and residency, you know, being sleep deprived, the pressures, balancing things, balancing friendships, balancing family, that was hard. So I would say first year of medical school and maybe my first year of internship. So I think we're running out of time. And again, I'm sorry. Normally I could spend like an hour, and, you know, we could do a second part as well if you have more questions. Thank you so much for taking the time to listen to me. And just know that medicine is a prestigious profession. It's a humble profession. It's hard. So it's, you know, you have to really want to do it. And just know that don't sacrifice your personal aspirations just for this, because you can balance both. It may be hard, but you can do both.
Thank you, doctor, for your insight. It was really helpful. We really appreciate it. You really helped out all these kids today. You know, we all really appreciate it. In terms of contacting you, what's the best way for everyone to contact you if they have any more questions?
Yeah, you can. I think you have my email. I'm on Instagram a lot, so you can follow me and then direct message me, and then give me a contact for you, and I'll contact you.
Okay.
That's probably the best way because I'm on there a lot.
Yeah. Well, thank you, doctor.
All right. Thanks, guys. Have a great weekend.
Same to you.
Okay, bye.
Bye.